But doesn't the government have to make the cuts?
No, not really. You see, our debt at the moment is about 70% of GDP. And between 1920 and 1960, our government debt actually never fell below 100%. And in fact, after the Second World War, our debt was something like 250% of GDP. And yet, Clement Attlee, with his Labour government then, was actually able to bring the NHS into being.
Aren't we in a much worse situation than other countries in the world?
No, in fact, we've got less debt than comparable countries like France, Germany, the US, much less debt than Japan. I know the Chancellor says we have to pay off our debts quickly in order to avoid passing them on to our children. But you see, a country isn't like a household. If you and I cut back, we don't have to worry about the wider implications. But if a whole country cuts back, this means less economic growth, less tax revenues for the government, and more money paid out in benefits to the unemployed. And after all, if the Chancellor was really that concerned about our children, he wouldn't be imposing huge debts on them for university tuition fees.
But doesn't debt have to be paid back somehow? How can it be done?
Well, there are lots of ways. To start off, the big corporations could pay their tax bills in full. We can invest in green jobs. That would be a great legacy for the future and a really good way to bring us out of economic depression at the present time.
Okay. You really thought this through, haven't you? Where do you get all this information from about the counter-argument against what the government is saying?
Well, we talk about it a lot at our union branch meetings. We go away, we read blogs, we read articles. It's a good way of getting to know a bit more about other ways of looking at things, other arguments than you get just by reading the newspapers or watching TV.
Well, I'm very interested in what you're saying because I've been worrying a lot about the impact on employment, on mental health, and I dread the increase in workload that all of this is going to mean.
I think you're absolutely right. And I think the government's planned changes to the NHS are very unlikely to provide extra resources to meet this additional need. There's no evidence that using private companies makes health provision any more efficient. And don't even start me off on the extra financial burdens that have been put on the NHS due to PFI contracts to build hospitals.
Okay. Well, I'll certainly think about what you've been saying.